Good afternoon, dear students. This is the Laboratory Animal Science, and this is the last lecture. This is the Pathology 2, the pathology caused by infectious agents. I try to draw your attention to April 27, 11 o'clock. Please sit before your PC because you will receive a personal email with the knowledge evaluation test. For that, you will receive 50 minutes to fill in and after return to me. The one more concerning the today's lecture. This is a highly important but highly difficult and complicated topic. So please put more time for the assimilation of these data, maybe 2 times more than compared to the other lectures. The study plan. After the introduction, we will see the selected viral, bacterial, and protozoal diseases, and finally the diseases caused by fungi and parasites, ecto and internal parasites. I have to emphasize that the diseases are selected to show you this topic, to show you what is really important, to show you what may be at the same time a problem for the pet rodents. But by no reason it can be a whole picture of the pathology. For that, I put at the end the sources. The sources are up to date, and at the same time it shows that the sources of most of our illustration. If not, I gave the person who offered the picture for us. So the important is as guise of introduction that the new transgenic strains, mice and rats, and more for the other rodents too. Please remember to the tau mutant hamster or the hairless guinea pigs, but more and more new transgenic and old mutant strains are present in the research. And therefore, these classical diseases may have different forms. Why? Because there is an unpredictable interactions among the genetic alteration what was made under transgenic animals, the original genetic background of the transgenic strains, the interaction of the exogenous factors and the infectious agent, or in many cases agents. It is also very interesting that many of the diseases has at least 2 forms. In immunocompromised animals, the diseases are more severe. The pathological signs are remarkable. So this is very important in the research for you. I give every time the sources that the pathological pictures are taken from immunocompetent or immunocompromised animal. For that, please let us revise and summarize the most important immunodeficiencies, taking the cause and the phenotype. You have heard about the nude mouse, the SID mouse, and the RAG mouse. And what is the nude mouse? The abbreviation of the one gene mutation is NU per NU. This is a spontaneous mutation. They are defective in transcription factor gene, which controls thymic epithelial cell differentiation. Phenotype is athymic and hairless. This hairless gene is not related to the immunodeficiency but linked. Consequence is that no T cell functions are present. The SID, the severe combined immunodeficiency mice, are defective in DNA-dependent kinase that recombines gene segments coding for T and B cell receptors. The phenotypic picture, they are hypoplastic lymphoid tissue carrier, no immunoglobulins or T cell responses present. They are sensitive to ionizing radiation because of defective DNA break repair. And last but not least, the RAG1 and 2 mice, they have defective recombinase enzymes preventing formation of functional B and T cell response. Phenotypically, they are hypoplastic lymphoid. They have hypoplastic lymphoid tissues, and as a consequence, they have no immunoglobulin-related or T cell related T cell responses. Viral diseases. The first viral disease will be the mouse hepatitis virus. The mouse hepatitis virus is very important because here you can see multifocal liver necrosis in normal and severe multifocal coalescing hepatic necrosis in SID mouse. Why can they attack the liver? Because the polytropic strains replicate initially in the nasal mucosa where necrotizing rhinitis may occur. Viremic dissemination can follow if virus gains access to regional blood vessels and lymphatics. Thus, viremia leads to secondary infection of vascular endothelium and parenchymal tissues in multiple organs, including the liver, brain, lymphoid organs, and other sites. Mice also may develop central nervous system disease by direct extension of infection from the olfactory mucosa along olfactory tracts. So at necroscopy, yellow-white foci indicative of necrosis can occur in multiple tissues with the involvement of the liver as a classical lesion. You can also see that liver involvement may be accompanied by icterus and peritonitis. Histologically, necrosis can be focal and confluent and may be infiltrated by inflammatory cells. You can see here viral mouse hepatitis with syncytial giant cells, hematoxylin eosin. And you can see in the right side at about 3 o'clock and at the top of the right picture. And here you can see that the syncytium formation is a hallmark of infection in many tissues. Necrosis and inflammation in mouse hepatitis virus infected liver. Coronavirus of mouse hepatitis, the line is equal to 1 micron, and the virus has a 100 nanometer of diameter. And in the middle of the picture you can see the syncytia, and in the right picture, this is an electron microscopic picture, the many virus particles. So as I've mentioned, the syncytia formation is a hallmark of infection in many tissues, including the intestine, the lung, the liver, the lymph node, spleen, thymus, brain, bone marrow, and also in vascular endothelium in general. So you can see here in the small intestine, see the arrow, the syncytium, and the endothelial syncytium in pulmonary vessels of an immunodeficient mouse infected with this virus. Once more, you can see the arrow. And the enterotropic strains infect primarily the intestine and associated lymphoid tissues, although some may also cause systemic lesions, especially in liver and brain. Pathogenic strains can cause lesions ranging from villus attenuation and atrophy to fulminant necrotizing enterotyphlocollitis, which can kill even the mice. Syncytia are a consistent feature in viable mucosa and may be present in many tissues. So you can see here on the picture the small intestine of neonatal mice infected with enterotropic mouse hepatitis virus. Villi are markedly attenuated with prominent syncytia of villus enterocytes. See the arrow. And right side you see an ascending colon from a mouse with MHV infection. Syncytia are present on the mucosal surface. See arrow. The ascending colon is the most common site to find MHV syncytia in adult mice. So in neonatal, the small intestine, and in the adult, the colon. And as I've mentioned, focal hepatitis is very typical. You can see on the picture on your left degenerated syncytium, see arrow, at the periphery of a necrotic focus in an immunocompetent mouse. And please compare it with the right picture. In contrast to the prominent syncytia arrowhead that are obvious in the liver of an immunodeficient mouse. So you see that the pathological sign is more accentuated and remarkable. And also the brain can be attacked. This is a vascular oriented encephalitis. You can see in the middle the red red blood cells from an immunodeficient mouse naturally infected with mouse hepatitis virus. And we can find also synthesia in mesenteric lymph node and endothelium of mesenteric vessels, but no picture is available. And as a summary of the phenotypic types of the disease is the clown mouse syndrome. The syndrome is not too frequent, is seen among weaning age mice, in which one or the entire litter may be affected. Typically, mice are runted and have general alopecia with varying amounts of normal appearing hair on the head, neck, and thorax. There is also often hyperkeratosis of the affected hairless skin. Affected mice have ongoing severe systemic disease or have recovered, resulting in temporary cessation of normal hair growth cycling. Hair growth cycles extend from head to tail so that regrowth appears first around the head and progresses posteriorly. Thus, the amount of hair varies and may extend over the neck and thorax in some animals. Clown mouse syndrome has especially been associated with both natural and experimental mouse hepatitis virus infection. And here you can see a picture of skin with intracytoplasmatic type A inclusion of mousepox, because the type B cannot be easily seen. This type A, the Marshall body, is well demarcated and acidophilic in standard histological picture. In the left side, you see epidermal hyperplasia and a very typical ballooning degeneration and intracytoplasmatic inclusions in the epidermis with underlying dermal edema. On the right side, you can see in color version. And what's happened in the organs, liver, spleen, lymph node, and pear plaques, owing to the intracytoplasmatic inclusion bodies, which are 1.5–6 micrometer in the infected cell, especially in the liver and spleen on the picture at your right. The gross pathological signs are pinhead-like necrotic spots in the liver and the spleen, multifocal necrotizing hepatitis and splenitis in a mouse during the acute phase of mousepox, and bleeding also beside. And the neurons are also attacked, mouse with posterior paralysis due to naturally occurring mouse ectromelia virus infection. Here you can see a living animal with posterior paralysis, and the spinal cord from the same mouse. There is acute neuronolysis in the ventral horn of the picture, comes from a ventral horn of the spinal cord. What is this picture? This picture is a very interesting one. The vaccination can control or prevent clinically apparent mouse pox. The hemagglutinin deficient strain of vaccinia virus is used to scarify skin in the dorsum of the tail, and takes should occur in previously uninfected mice by 6 to 10 days, but not in infected mice. So this is a use of the mice to detect the efficacy of the vaccine. And we finish the mousepox and we move to the next disease. This is rotavirus caused episodic diarrhea of infant mice, EDIM. It is not only in mice but also in rats. The disease clinically is a severe diarrhea and high newborn mortality. On the picture you can see that the stomach is full, the small intestine are flexed and dilated, and pasting of the tail base with soft feces. You can see at your right. And if you see the histology of the episodic diarrhea of infant mice, EDIM, caused by rotavirus, you can see a picture of a small intestine. From a small intestine, cytoplasmatic swelling of enterocytes at the tips of the villi. The next disease will be also a very important, and this is the Sendai disease or murine respirovirus. It is the name came from a Japanese city where it was found first. Sendai disease can be found in mice, rats, hamster, and guinea pigs. It causes not only the clinical signs but also complications in the research, immunosuppression, slow wound healing. What is caused by the clinical sign? This is a death and mostly of the newborn, reproductive failures of the adults, and very interesting that there is a seroconversion in human and guinea pig, but without any problem. In some textbook you can find as a possible zoonosis because of this fact, but this is not a zoonosis. These are pictures of damage, lung damage. Lung from DBA mouse. Of course, you never have to memorize the DBA or not DBA mouse. You have to memorize that in immunocompetent mice and immunocompromised mice. So note the dark areas around the hills of both lungs, consistent with congestion and early consolidation. And right side you see a comparison of the damaged virus, damaged lung, and the control lung. What is the histological picture of the Sendai disease? This is a non-suppurative intestinal pneumonitis. You can see the histiocytes everywhere in the intestinal tissue. And not only in the intestinal tissue, but you see that Sendai virus will cause also necrotizing bronchiolitis. You can see here a series of death cells. And the sensitivity of different strains against the Sendai virus is highly different. By means of bioluminescence pictures, we can see the extension of the lung damage and the damaged tissues of the different strains. And you see that the field of the attacked damaged tissues are uh, larger or smaller according to the different strains, inbred strains. Here you can see the reparative phase of the Sendai disease, lung from a mouse in a reparative phase following recovery from Sendai virus infection. Note the cuboidal metaplasia of pneumocytes lining alveolar septa. So you can see everywhere strong adjacent cells. The next viral disease is the disease caused by Cyanodacryadeninitis virus or rat coronavirus, SDAV or RCV. But related to the complications with the research, interact disturb the eye, salivary gland, and lung researches, reduce litter size, and a growth retardation of sucklings is typical. This coronavirus causes inflammation and edema of the cervical salivary glands and harder gland, extraorbital lacrimal gland in rats. Caretakers of infected rats often describe their animals as having mumps. Cyanodacryadeninitis virus infection is highly contagious. It initially causes rhinitis, followed by epithelial necrosis and inflammatory swelling of the salivary and lacrimal glands. Cervical lymph nodes become enlarged. During acute inflammation, affected rats are at high risk of anesthesia-related mortality because of decreased diameter of the upper respiratory tract lumen. Yes, the next picture shows us the ocular lesions such as conjunctivitis, keratitis, even corneal ulcer can be found, can occur secondary to lacrimal dysfunction. And here you can see the chomorhinodacryorea, the so-called red tails around the eyes. And here you see the necropsy of the salivary glands of a rat. And the next picture shows us a histology and luminescence histological picture of the parotis with the virus particles. In the next picture, you can see the two phases of the disease. On the left side, you can see the phase 1 submandibular salivary gland from a rat during acute SDAV infection. Note the epithelial necrosis, leukocytic infiltration, and interlobular and periglandular edema. Parotid salivary gland during early resolution of SDAV infection shows you the phase 2 on your right. Ducts and acini are lined by undifferentiated hyperplastic epithelium, and the interstitium is infiltrated with mononuclear leukocytes. The next virus was found isolated by Sebastian. Muscle, you can see as a sign of degeneration, calcium retention in muscle of seed-suckling mice. What is black, this is the calcium by Magyari Kosha painting. I draw your attention that Magyari Kosha used to be the professor of the pharmacology 100 years ago or more. The next disease is the poultry Marek's disease. I don't go into the details because you will learn a lot during microbiology and epizootiology from the Marek disease, but the poultry as a subject of research, vaccine production and development is very important. And you see here that the typical gross lesions of the neurodegeneration are enlargement of one or more peripheral nerves. Affected nerves are up to 2-3 times the normal thickness. And nerves commonly affected are the brachial and sciatic plexus. You see here on the picture the sciatic nerve enlargement and the sciatic plexus enlargement. This is very good for diagnosis, pathological diagnosis. But this is the most important why I mentioned for you. Before it was an orphan model, even you have learned as an orphan model because it has no human counterpartner, human disease. But I found in the literature, in the brand new literature, that today can be used as a model for human diseases, the Laundrie-Guillain-Barré syndrome, and also for the model of human neurolymphomatosis. As a veterinarian, is important also that the Marek can be a good model for avian retroviral infection. So it is no orphan model anymore. The next virus is highly important, and it was partly mentioned in the Pathology 1 in the section of zoonosis. The lymphocytic choriomeningitis virus, LCMV, can be found in small rodents. It can compromise the research, being immunosuppressive, can cause death of the animals. It can go through the placenta and may cause zoonosis. And here you see the basic phenomenon associated with infection of mice with lymphocytic choriomeningitis virus. And 4 basic patterns of clinical disease are recognized from study of experimentally induced infections. You can see the cerebral form is characterized by illness in immunocompetent mice beginning 5-6 days after intracerebral inoculation of virus. Sudden death may result or subacute illness. The second form is a visceral form, can occur in adult mice inoculated by peripheral routes with viscerotropic strains. It can be asymptomatic or lead to clinical signs, including ruffled fur, conjunctivitis, ascites, somnolence, and death. And the form 3, runting and death from LCMV infection, may occur in neonatally infected suckling mice and can lead to transient illness or to death. Clinical signs are non-specific. And form 4 is late onset disease, can occur in previously asymptomatic carrier mice that develop immune complex glomerulonephritis. And here you can see the first form, lymphocytic infiltration of meninges of a mouse inoculated intracerebrally with lymphocytic choriomeningitis virus. So this is the picture of the meninx. And the form 4, you can see the thickening of glomerular basement membrane in late onset LCM disease. And this was the short selection of viral diseases, and we move to the bacterial diseases. From the bacterial diseases, the first is the syndromes caused by the Pasteurella pneumotropica. This is a gram-negative. The form may be coccobacilli or filaments. And of course, it is in the name that the first attacked organ is the lung. But what is interesting for the laboratory animals that the reproductive organs are highly sensitive. In females, the uterus and the ovaria, and in males, the Cowper gland and the prostate. Here you can see Pasteurella pneumotropica caused Cowper gland inflammation in the mouse. So you can see the urinary bladder, the prostate, and also the Cowper gland in inflammation. The next bacteria may cause the pseudotuberculosis, and this is the Corynebacterium kucheri. In the middle, you can see a highly typical pseudotuberculotic picture. This is a multifocal, chronic, purulent, supparent bronchopneumonia. Very typical. And here you can see also pseudotuberculosis. Left side, multiple foci of abscessation with peripheral redding and consolidation in the lung. And because there is a septicemia, multifocal hematogenous renal abscesses in rat kidneys. If we see the histological pictures, left side you can see lung with inflammation arising at the terminus of a small artery arrow, indicative of hematogenous dissemination of the bacteria by the blood. And at your right, a section from a liver, abscess in a rat. Note the prominent colonies of bacteria. You can see the arrow. adjacent to the necrotic center of the lesion. The next bacterium will attack the respiratory tract. This is the cilia-associated respiratory bacillus, or CAR bacillus. It can be found in glires, from rodents up to the rabbit. Respiratory alteration and sometimes death is typical. The respiratory mucosa with rafts of bacteria with the arrows can be seen, and the epithelial brush border and within the exudate. Of course, that this histological picture is not enough for the diagnosis, because another bacteria can have a similar picture, so we have serological confirmation of the disease. And we move to the digestive tract, and you see the Clostridium difficile, which will cause necrotic enteritis. You can see that the stomach and after the small intestine are in inflammation and necrosis. This is from the family of Clostridia, and this is very severe intestinal disease. Here you can see that especially in sensitive animals like postparturient lactating animals with markedly dilated intestine filled with fluid and gas. The mouse has been skinned and the intestine is visible through the unincised abdominal wall. And if we see the histology of the Clostridium difficile caused disease, you can see the large intestine of a mouse. There is a moderate hyperplasia of crypts with marked edema and leukocytic infiltration of the mucosa and submucosa of the infected animals. The clinical signs, of course, will be a diarrhea and sometimes exocosis and mortality. In causing diarrhea, the clinical signs are similar. In case of the Citrobacterium rodentium, you see the left side that the cecum and colon are in a diffuse hyperplastic colitis or typhlocollitis. The infected bowel is contracted, opaque, and devoid of feces. Yes, and besides the diarrhea, there is the defecation is painful and very frequent, and therefore the rectal prolapses in a mouse with this so-called transmissible murine colonic hyperplasia due to Citrobacterium rodentium is typical, very common, this rectal prolapse. And if we see, let's see the electron micrograph of Citrobacter rodentium attached to colonic enterocytes. You can see up. Note the intimate attachment of bacteria with disruption of the brush border. Once more, I have to emphasize that the serological confirmation is necessary in this case too. But first candidate for the differential diagnosis is the hyperplastic colitis caused by Escherichia coli E. coli. At the left you can note the segmental thickening of the colon. You see the arrows. Unlike the involvement of the descending colon in mice infected with Citrobacter froindi. So a little bit can be seen the differences that also we have to make the differential diagnosis from both E. coli and Citrobacter, the Helicobacter diffuse involvement in mice with Helicobacter. And we move to the next bacterial disease, the Titzer disease. The Titzer disease is caused by Clostridium piliforme. It was previously Bacillus piliforme or Bacillus blue, but the Titzer disease can be found from the mouse up to the foal of the horse. The signs are in a so-called triad because typical is in the colon, in the liver, and in the heart muscle. Colon, liver, heart muscle. And we can see a necrotic typhlocolitis, a multifocal necrotic liver, and a multifocal necrotic myocarditis. Here you can see the Titzer disease in the colon, this necrotizing colitis. And the next picture shows us the Titzer disease macroscopic growth signs in the liver, bacterial hepatitis. And the third is the heart muscle, myocytic stripes in mouse in small enlargement. Can you see this myodegeneration and in big enlargement? Summarizing slides about exclusively about the mouse Titzer disease. Picture 1 is a transmission electron micrograph of Clostridium piliforme bacterium. The bacillus is surrounded by large numbers of peritriches flagella. The middle picture, hematoxylin eosin stained tissue section of liver from a mouse with Titzer's disease, showing characteristic hepatic lesions and inflammatory response. Silver stained tissue section of liver from a mouse with Titzer's disease at your right, the right bottom, showing intracellular bacilli in a pick-up stick array. And the right picture, a photograph of gross lesions in a mouse with Titzer disease demonstrating multiple foci of hepatic necrosis. Also, another picture about the macroscopic hepatic necrosis. This is a mouse liver, multiple umbilicated lesions on the capsular surface on your left picture, and right side you can see the intracellular bacteria, the filaments of the bacteria. In the rabbit, the Titzer disease have to be differentiated from the pregnancy toxicosis. Left side you see liver and intestine of Tietzer's disease, and right side you can see without the necrotic foci a pregnancy toxicosis, enlarged liver, and right side a healthy liver. The next disease are focused on the liver, and this is the Helicobacter hepaticus, which is also very typical in causing focal necrotizing hepatitis. Here you can see the histological picture of the Helicobacter hepaticus infected liver. But the typical histological method are the silver impregnation. Left side down at about 7 o'clock, you can see these black filaments. There are Helicobacter hepaticus in altered liver tissue. And right side, you can see depicting characteristic Helicobacter organism on this picture within the bile cuniculi, these black formations. The next disease is the salmonellosis of the rodents. In case of septicemia, because it may have another form, in the liver, we can see also circumscribed lesion, which consist of aggregations of histiocytes. The next disease are caused by the different mycoplasma, and this is mostly a respiratory form, lung from a mouse with respiratory mycoplasmosis. Note the multiple pale raised bronchial ectatic lesions, left side, and right side, the larynx from a mouse with chronic mycoplasmosis. Multinucleated giant cells, you can see many, are present in the respiratory epithelium. This is a common feature of the disease in this species that is not seen in rat. So it's a great difference in mouse and rat respiratory mycoplasmosis. If the mycoplasmosis is long-lasting, we can have also otitis. On the picture, you can see a bilateral chronic suppurative otitis media due to Mycoplasma pulmonis infection. Note the presence of exudate in the opened tympanic bullae. Only I've mentioned that in fattening pig you can have also similar problem with the otitis media. And we arrive to a bacterium which is mostly a secondary infection, but of course can cause septicemia, but the secondary infection is most typical. Here you can see muzzle furunculosis in a nude mouse associated with Staphylococcus aureus infection, and also on the legs you can see the signs of Staphylococci. And as I've mentioned, is typically a secondary infection. Here you can see a ulcerative dermatitis with denuding of hair associated with acariasis. see later, and secondary staphylococcal infection, pruritus associated with acariasis may lead to self-inflicted skin abrasions with superimposed bacterial infection, because Staphylococcus can be found everywhere. And we move to the protozoal diseases, protozoans. Only some endoparasites encountered in the digestive tract and in the brain. The protozoan parasites in the digestive tract are the Spironucleus muris and the Giardia muris. They are considered pathogenic even though they are not associated with clinical signs in immune-competent hosts. But we have to mention that first we have to see the encephalotozone cuniculi, ECUN, which was once mentioned because this is possible zoonosis. The name is cuniculi, it means rabbit, but it is found in all the members of the Glires superordo, contrary to the name. The histological alterations are typical in brain and kidney, and all these can disturb the evaluation of another research. But continuation with the protozoans of the digestive tract, here you see the Entamoeba muris in the middle of the picture. And you can see also this is the content of this is a gut content. And also the Spironucleus or Hexametamuris, which is also a facultative pathogenic, and if the cage is overcrowded, can be pathogenic. In the gut content is moving like a fish. Left side you see a scanning electron micrograph of trophozoites on the duodenal mucosal surface, and right side you can see the swimming spironucleus. If we see the histological picture, you can see the spironucleosis, the Spironucleus muris infestation or infection in a young mouse with diarrhea. Large numbers of trophozoites are present on the duodenal mucosal surface, left side. And right side you can see the electron microscopic picture. And here you see also that Spironucleus muris or Hexametamuris as an inhabitant in the crypts of Libercool, the right side. We have to mention also the Giardia muris, which have a circling movement. This is also a facultative pathogenic parasites, protozoa. Here you see the Giardia muris cross-section with adhesion disc over the microvilli, and I've shown this picture during the chronic, the lecture of the chronic stress, because of course that they are not strong pathogenic, but the presence of a great number of Giardia and other from these can cause a bad feeling. And we continue with the Saccharomycosis, yeast and fungi. The Saccharomycosis as a disease or state can be caused by Saccharomyces yeast, and in case of the rabbit, this has a special name because this is a special subtype, the Cuniclomyces gutulatus. And here you see that Saccharomyces are, here you see in a rabbit that Cuniclomyces gutulatus can cause gas production in the intestine, prolapsus of the anus because of the straining and defecation, and right side a native and hematoxin eosin picture from the stomachal wall, because in this case the yeast will grows not only in the intestinal lumen but also will be transmitted into the stomach. The next disease is a model disease that we can see that this primitive fungus, this pneumocystis carini, extracellular primitive fungus, it is zoonotic even in human, in immunocompromised human, for example, with HIV infection or steroid treatment. But returning to the mouse, in case of the mouse, also the immunocompromised mice are very prone to the infection. Left side and right side you can see typical damaged lungs caused by pneumocystis carini. And here you can see also lungs from immunodeficient mice with pneumocystis murina pneumonia. The lungs are pale, fleshy, and collapse poorly, typical gross findings. And by the blood circulation, the brain can also be attacked, as you see on this picture. You can see the histology of lungs from a mouse with pneumocystis murina pneumonia. Left side, hematoxylin eosin, and right side, large numbers of cyst forms are present in alveoli by silver stain, and the next picture you can see by electromicroscopic picture. And we move to the parasites. And the parasites will start with the ectoparasites. And first we see the dermatophytosis or favus or ringworm in mouse. This is a fungal infection caused by Trichophyton quinquennum, Trichophyton metangrophytes. Lesions are most common on the face, head, neck, and tail. The lesions have a ragged appearance with patchy areas of alopecia and variable degrees of erythema and crusting. Pruritus is usually minimal to absent, and the lesions do not fluorescence under ultraviolet light. Mice are important as carriers and represent a zoonosis also. The name that ringworm is a misnomer, since a fungus, not a worm, causes the infection. The lesion caused by this infection resembles a worm in the shape of a ring, especially in human, and hence the name. And the next group are the acariasis or mange. And these are generalized thinning of the hair, especially on difficult to groom areas such as the head and trunk. The coat often has a greasy appearance, and in cases of heavy infestation, noticeable pruritus and self-inflicted dermal ulceration may occur. The most commonly seen mites are the Myobia musculi, the Myocoptes musculinus, and Rutfordia affinis. But here you can see a very interesting ear mange case in a rat caused by Notoadres muris. Note the disfigurement of the ears associated with proliferative dermatitis. And here you see a list of the acariasis-caused organisms, the manges, Sarcoptes, Notoadres, Myobia musculi, Rutfordia, Ensiphera, and affinis, and Myocoptes musculinus. Here you can see how we can take sample from a mouse by skin scrap, but this is also possible by a cellophane tape. And here you see the Myobia musculi female, only to emphasize that the sexual dimorphism in case of the mites is high. And one picture you have seen 5-10 minutes ago, the ulcerative dermatitis with denuding of hair associated with acariasis and secondary staphylococcal infection. See earlier, pruritus associated with acariasis may lead to self-inflicted skin abrasions with superimposed bacterial infections. The next group are the follicle mites in mouse and hamster. Follicle mites inhabit in hair follicles. Dermal cysts appear as small white nodules in the subcutis. And here you can see Psorergate simplex infected skin inverted to show pouches, left side, and right side, skin from the head of a wild mouse infected with Psorergate simplex. Note the mites at the periphery arrow of a cystic follicle filled with keratin. And in hamster, the follicle mite can cause demodicosis. And the last group of organisms are the lice, mouse louse. This is a Polyplex serrata female. Once more, the sexual dimorphism is high. These are caused pediculosis. And we move to the last group, the nematode or round worms and the tapeworms. And here we have to mention the mouse helminth pinworm or Syphasia obvelata. This is a gut content with the eggs of the Syphasia. And here you can see the mouse pinworm, the Syphasia obvelata, females full of eggs. And concerning the eggs, this is a collection of eggs of Syphasia muris, left, Cyphasia obvelata and Aspiculouris tetraptera right, and Humanolepis nana, the next and last organism, bottom. And here you see the Humanolepis nana. This is a dwarf tapeworm with a possible zoonotic capacity. I have to draw your attention to the sources. Most of the pictures are from these sources. The exception are given. And speak about what is common in both of us. Please prepare for the knowledge evaluation. Thank you very much for your attention.